Hi, I'm Ruth O'Regan, Chair of Medicine at the University of Rochester. So CDK inhibitors are a relatively new class of agents that what they basically do is they stop cancer cells multiplying or dividing. So the hallmark of cancer cells is that they multiply much more quickly than normal cells in the body. And they go through a specific, what's called a cell cycle. So what the CDK inhibitors do is they impact some proteins that are, pivotal to this cycling of cancer cells. And by using the CDK inhibitors, you actually block the cell cycling, resulting in the cancer cell basically slowing down its growth and potentially dying. So we currently have 3 of these agents approved: abemaciclib, ribociclib, and palbociclib. And they're approved for patients with hormone receptor positive metastatic breast cancer. And what's been shown is that when you combine them with endocrine therapy, patients have control of the disease for 50% longer than patients who get endocrine therapy alone. So they really have, markedly improved outcome for patients with metastatic hormone receptor positive disease. Recently, they've also been looked at in patients with earlier stage disease. So there's a number of clinical trials that have looked at these agents in patients with estrogen receptor positive, early stage breast cancer with positive lymph nodes. And out of 3 studies, 1 has shown positive results, the other 2 have not. So it's a little bit controversial at this time, and it's not standard of care, although I think in patients that have high risk disease or high risk of recurrence, we might consider adding one of these agents in with endocrine therapy, even in this earlier stage setting, in an attempt to decrease the likelihood of recurrence. So they're very important agents. They currently, the only marker we have to show which patients are going to benefit from these drugs is the estrogen receptor. So there really hasn't been any other markers that have kind of shown us which patients need these agents. As far as their tolerability, they're generally well tolerated. They can cause some drops in white blood count, and abemaciclib can cause diarrhea, but overall, they're reasonably well tolerated for patients.